Okay. Hi, Michael. How are you?
Good morning. I'm doing pretty good.
Nice talking to you. My name's Ashley McMillan. I'm one of the dentists here on staff at UAMS, and I heard you were having some issues with your mouth, and I just wanted to talk to you about some next steps and ask you a few questions so we can get you taken care of, okay?
That would be a big help. Yes, ma'am.
You're welcome. So my understanding, based on reading your chart and talking to the physicians that you just spoke with, is that about 4 months ago you started to experience dry, painful mouth, and you equate that with consequential weight loss afterwards. Is that correct?
Yes, ma'am. About 3 months ago, I started noticing weight loss, and over that 3-month period now, I've lost about 30 pounds. And I attribute that to the dryness in my mouth and the pain I'm experiencing.
What I'd really like to do, and I know the physicians have gone over this with you, I'd really like to get you in to see us at the dental clinic. But I want to talk about what you've kind of done for yourself in the meantime to take care of the problem, if you've tried any over-the-counter remedies or anything like that, so I could at least maybe offer something to get you comfortable until we can get you in.
I really haven't, actually. I've tried, chewing on some ice chips and some ice just for the dryness in the mouth, but it's so painful to eat. Is there anything that I can get over the counter that would help me with these symptoms?
Sure. There are. I will say that a lot of people do suck on ice and drink water to help. That's not a bad idea, just to stay completely hydrated so that we can eliminate hydration as being a problem for you. There are some products. Biotine makes a really great mouth rinse. They make a bunch of products actually that can help with the dry mouth. There's some new products that have come on the market too, some sprays that really help, and people have had a lot of success with them. I would recommend in the meantime, until I can see you, to work on Biotine, because the other products that have come out are something that we would have to order direct from the pharmacy and have it sent to your house since they are so new. Would you say that what happened 4 months ago has been a burning mouth sensation, just discomfort? I want to kind of eliminate something with that. That's why I'm asking that question.
It's not a burning sensation.
Okay.
It's just more of a dull, painful ache.
Okay.
And it just is so very uncomfortable.
Sure. Sometimes, the reason I ask that is sometimes people can be on chronic antibiotics for other ailments, and it can cause them to get thrush, and that can be really painful and kind of leave you with a scalded mouth syndrome. And so I just wanted to make sure you haven't been on a ton of antibiotics recently, have you?
Well, actually, yes, ma'am, I have, because, of course, I'm in end-stage renal failure, and I'm trying to get on a transplant list right now.
Okay.
And they do have me on some antibiotics. I don't know, Jake keeps up with all that, and he's not here, so
Okay.
I don't know exactly what all it is, but there are antibiotics being taken by me, yes.
Okay. And that's something that I can follow up with your physicians and the pharmacists about, and we can kind of work together as a team to see if maybe it's even, whether it's antibiotics that are prompting this issue, or whether or not it could be that some of your prescriptions cause dry mouth, and we could talk to the pharmacist and your renal doc to see if there's any modifications to the medications we could make that might alleviate some of the dry mouth. So we'll kind of talk in the meantime until we get you in to see me about what some other approaches might be to help you.
That would be wonderful. My concern is whether or not, when I come see you guys, whether or not my medical insurance will cover that, because I'm not sure that we have dental insurance.
Sure. So in that situation, especially at UAMS, we would work with you to find out, considering you have end-stage renal disease and you're looking for a transplant, there's plenty of options where if something is medically necessary as a dental procedure, we can work with your medical insurance on that. I do realize that dental insurance seems to be a luxury, so we would understand that and work with you. We have a dental hygiene school that offers lower cost cleanings to those that don't have insurance. There's a lot of resources that we can use that maybe only people in the dental clinic might be aware of. So the first step would be just getting you an appointment and having that conversation, and setting aside plenty of time to talk about our resources to make sure it's not a financial burden to get your mouth healthy.
Will I call you guys, or your office call me to set up the appointment?
We will be calling you for the appointment because your physician's putting in a referral, and we will contact you to set that up. And I do recommend that you bring your partner to that visit, since he seems to be abundantly aware of your health history and your medicines, and that way this can be a really productive visit. And one thing I did want to mention too, your oral health is extremely important, because I also see in your med history that you've got diabetes, hypertension, you've had an aortic valve replacement, you're planning to get cleared for a kidney transplant. And a lot of people don't realize that periodontal disease can exacerbate hypertension and heart disease. Diabetes and periodontal disease actually further exacerbate each other. So getting your oral health under control can actually improve your diabetic control, your hypertension. Aortic valves like to have the bugs that are in our mouths attached to them, so it's very important that we keep your mouth healthy and get everything squared away before you would potentially get a transplant. So it's very important that we see you and get you holistically healthy.
Thank you, Ashley, for checking in with me today. I really appreciate your help.
Okay, we'll have somebody call you.
Okay.
Bye.